Okay, so let's discuss respiratory alkalosis, acidosis, and mixed acid-base disorders. Okay, so for respiratory acidosis, so this is number 3, respiratory acidosis. Okay, so for respiratory acidosis, the cause of respiratory acidosis is excessive carbon dioxide accumulation. Okay, so meaning there is increase in CO2 level. Okay, that's for respiratory acidosis, accumulation of CO2. And remember, if there's increase in CO2, the pH will drop. Why? It's because of the inverse relationship of CO2 to pH. Okay. Next, what are the conditions associated with respiratory acidosis? So first is COPD. Okay. Chronic obstructive pulmonary disease. So usually COPD is common in smokers. Okay. And another disease, you have myasthenia gravis. Okay. Myasthenia gravis. So for myasthenia gravis, it is an autoimmune disorder. Okay. It's an autoimmune disorder where the antibodies, the autoantibodies, attack, okay, the connection, okay, or it attack the nerves, okay. And the function of nerves is to send signal to your muscles for your muscles to move, okay. So for myasthenia gravis, since it's an autoimmune disorder that is associated with or there's a presence of autoantibodies that attack the nerves. So it's associated with muscle weakness. And regarding breathing, okay, ang pagginhawa, it's regulated by muscles, okay? So there's muscle weakness, meaning there is decreased excretion of CO2. So it will lead to accumulation of CO2 in the body. Okay. Another, if there is CNS problem or central nervous system problem. Another is there is overdose of drug like morphine. Okay. Another, if there's pneumonia. Okay. And botulism. Okay. So for this one, for respiratory acidosis, regarding the compensation, okay, the compensation is to retain bicarbonate, okay, retain bicarbonate, okay. So it's to increase bicarbonate level, okay. So after the compensation, the level of PCO2 is increased, same with bicarbonate, and the pH is less than 7.4, okay. And for maximal compensation, it takes 5 days for a maximum compensation for respiratory acidosis. And another way to compensate this one is through excretion of acids. Okay, so that's for respiratory acidosis. Now, if we're going to apply the formula, okay, pH is equal to bicarbonate over CO2. So let's start with an uncompensated type of respiratory acidosis. So the pH is abnormal, which is, for example, 7.30. Bicarbonate of 25 and PCO2 of 55. Okay. So this one is for uncompensated. Why? The pH is below normal. The reference range for pH divides from 7.35 to 7.45. Okay. Then the bicarbonate level is within the reference range. Reference range for bicarbonates is 21 to 25. Then PCO2, it's 55. So normal, low. And for PCO2, it is increase because the reference range for PCO2 is 35 to 45. Okay. So the pH is low. And the reason why there's a decrease in pH is because of the increase in CO2. Okay. So increase CO2, decrease pH. That's why it's respiratory acidosis. Okay. So this one is uncompensated. For partially compensated, okay. So let's change this one to 7.32 and bicarbonate level of 32. Okay. So pH is below normal. Bicarbonate is above normal, so it's increased. Same with PCO2. Okay. So you have low pH, increased bicarbonate, and increased CO2. So for this one, what is the cause in the decrease in pH? Okay. This one or this one? Okay. So if there's an increase in bicarbonate, the effect of increase in bicarbonate is decrease or increase in pH. Okay. Now, what's the relationship of bicarbonate to pH? It is directly proportional. Meaning, if there's increase in bicarbonate, there's also increase in pH. So this one is not the cause of respiratory acidosis. This one is the cause because if there's increase in bicarbonate, CO2, the pH kaya mo decrease. There's accumulation of CO2 in the body. Okay? So that's for partially compensated. So it's partially compensated because the bicarbonate level is increased. The reason why there's increase in bicarbonate is to compensate the respiratory acidosis, to increase the pH. Okay? That's the reason why there's increase in bicarbonate. Okay, to increase the pH, to bring back the pH to normal level. Okay, so that's the purpose of the increase in bicarbonate. Okay, so this one is partially compensated because the pH is not normal pa. Okay, it's below the reference range. Now, if we're going to talk about or discuss fully compensated respiratory acidosis, and usually it takes 5 days to have a fully compensated respiratory acidosis. Okay. So example, you have pH of 7.36, which is normal because the reference range for um, uh, pH is 7.35 to 7.45, but it's below 7.40 or 7.4, but within the reference range of 7.35 to 7.45. Okay, so normal. So this one is normal. Then you have abnormal bicarbonate and abnormal CO2. So this is the pattern for fully compensated respiratory acidosis. Normal pH, high bicarbonate, high PCO2. High bicarbonate is the compensation, high CO2 is the cause of respiratory acidosis. Okay? It's fully compensated once the pH is normal or within the reference range. Okay? So that's for respiratory acidosis. Okay? So what are the causes of respiratory acidosis? You have COPD, pneumonia, myasthenia gravis. Remember, myasthenia gravis is an autoimmune disorder. Okay? So meaning there is production of autoantibodies that attack the muscles. And regarding muscles, muscles are important in breathing. Okay, if you have weak muscle, weak po ang breathing. So there's accumulation of CO2. Okay, so that's for respiratory acidosis. Okay, so next is we'll discuss respiratory alkalosis. For respiratory alkalosis, Number 4, respiratory alkalosis. Okay. Respiratory alkalosis, there is increased carbon dioxide loss. Okay. Meaning there's decrease in CO2 level. Okay. And what are the conditions associated with increased loss of CO2 or decrease in CO2 concentration? First is rapid breathing or hyperventilation. And usually, hyperventilation mo happen siya if you're anxious, okay? So anxiety. Then if you're experiencing severe pain, that's another cause, okay? If you're in pain, usually you hyperventilate, okay? Then next is if you have asthma. Then if there is aspirin overdosage, okay? So those are some of the examples of causes of respiratory alkalosis. So during blood collection for blood gas analysis, you need to assure your patient that the procedure is not that painful or make your patient calm, okay? For the procedure, pangkalmahon mo siya, okay? Kalma, okay? So you need to have, uh, you need to establish rapport, okay? So dapat ma-convince nimo imong patient that the procedure is not that painful so that dili siya ma-stress because once ma-stress there's a possibility nga mag-hyperventilate. And once there's hyperventilation, your blood gas analysis is affected. Okay? So, mo to siya, respiratory alkalosis. Okay? Another cause of respiratory alkalosis is pregnancy. Or if you're using high progesterone drugs or progesterone drugs, it facilitates hyperventilation. Okay? So for compensation of respiratory alkalosis, I have decreased bicarbonate or decreased retention of bicarbonate. Okay. And usually it's fully compensated within 2 to 3 days. Okay. So pattern for this one, you have low PCO2, low bicarbonate, and uh, a pH of greater than 7.4. Okay. Or if it is uncompensated, greater than 7.45. Okay. So among the 4 types of acid-base disorder, this one, okay, respiratory alkalosis, this one has the most effective compensation. Okay. So within 2 to 3 days, you have fully compensated respiratory alkalosis. Okay. So we'll try to use the formula, okay, in identifying or uh, uh, identifying or identifying the cause and the compensation using the formula. Okay. So pH is equal to bicarbonate over CO2. Okay. So for respiratory alkalosis, for example, 7.49, a bicarbonate level of 22, PCO2 of 28. Okay. So for this one, the pH is above normal, so it's increased. Bicarbonate is normal, so meaning there's no compensation pa. And the PCO2 level is below normal. So this one is the cause of the increase in pH. Okay, decreased CO2 level due to hyperventilation. Okay, so this one is uncompensated respiratory alkalosis. Okay, Now, if it is partially compensated, so let's try to adjust this one to 47 and this one to 18. So you have high pH, low CO2, and low bicarbonate. Okay? So the reason why there is decrease in CO2, it's because of hyperventilation. That's why me increasing pH. Okay? Drop CO2, increase pH, alkalosis, respiratory alkalosis. Now, the bicarbonate level is decreased. Why? To compensate this one. The purpose of decreasing the bicarbonate is to decrease the pH, blood pH, in order for the pH to go back to normal. Okay? So this one is partially compensated because the pH is still abnormal. But once normal siya, and you have abnormal results for bicarbonate and PCO2, that's fully compensated. And it usually takes 2 to 3 days for respiratory alkalosis to be fully compensated. Okay? So that's for respiratory alkalosis. So respiratory acidosis, then respiratory alkalosis. Okay? So alkalosis, you have hyperventilation. Okay? So kung makuyawan ang patient, mag-hyperventilate na siya. So for example, if ang student, nakuyawan siya because he has 5 exams in one day, kuyawan siya, okay? So mag-hyperventilate, then you'll experience respiratory alkalosis. Okay? Last, the mixed acid-base disorder. Okay? So for mixed acid-base disorder, okay, 2 or more primary acid-base disorders coexist. Okay? And there is inappropriate compensation. Okay? So hopefully na-observe ninyo, once there is decrease in CO2, usually the compensation is to decrease bicarbonate. Okay? If there is increase in CO2, the compensation is to increase bicarbonate. Or if the cause is decrease in bicarbonate, the compensation is to decrease CO2. Another, if there is accumulation of bicarbonate, the compensation is to accumulate CO2. So one direction, one direction, one direction, one direction. Okay? For mixed acid-base disorder, it's like this. So for example, pH increase, then for CO2, it is decrease, and bicarbonate level of increase. So you have arrow up for bicarbonate and CO2 arrow down. Okay, so this one is an example of acid-base disorder, not one direction. Okay, so opposite ang iyang directions between bicarbonate and CO2. One is lower, one is higher, or one is low, and the other parameter is high. Okay, that's for mixed acid-base disorder. Okay, so the blood pH will be determined by the dominant disorder. Okay, so muna siya for acid-base disorder, mixed acid-base disorder. Okay, so the next meeting, we'll continue our discussion regarding acid-base. We'll focus on specimen collection and specimen requirements, okay, for acid-base disorder. Thank you.